Hello, my name is Rashida Shah, and today I will be discussing the obesity epidemic prevalent in the United States and how the MyPlate app can help individuals lose and maintain a healthy weight. Obesity is used to describe an adult whose weight is above the recommended healthy weight for his or her height. A BMI or body mass index measures an individual's weight in kilograms over height in meters and is used as a screening tool for obesity. An adult with a BMI of greater than 30 is considered to be an obese person. According to the Center for Disease Control and Prevention, 39.8% and about 93.3 million of U.S. adults are considered to be obese. So this map, every year the Center for Disease Control and Prevention maps out self-reported obese individuals in the United States. The map is color-coded to indicate the prevalence of obesity in each state. 2 states have been identified to have an obesity prevalence of above 35% among Caucasian individuals, and 9 states have a 35% prevalence of obesity among Hispanic adults. Every state has an obesity rate of greater than 20%. Overall, the Hispanic 47% and African American 46.8% population have been identified to have the highest prevalence of obesity. About 35.7% of adults between the ages of 20 to 39 years are obese. 42.8% of adults between the ages of 40 to 59 years are obese, and 41% of adults between from 60 years or older are obese. A decrease in the number of obese individuals would result in decreased medical and productive costs, individuals that would be healthier mentally and physically, and a decrease in comorbidities such as heart disease, stroke, cancer, and diabetes. In 2008, it was found that the overall medical cost for obesity was $147 billion, and the cost for an obese individual was $1,429 greater than for a healthy weight individual. And in 2013, the cost for an obese individual was $3,429 greater than a healthy weight individual. Furthermore, the annual cost for healthcare cost for obesity-related diseases is $190.2 billion. Direct costs include outpatient and inpatient health services, such as surgery, lab testing, and drug therapy. Moreover, obesity can lead to increased health risks and illnesses such as high blood pressure, high cholesterol, diabetes, heart disease, stroke, sleep apnea, depression, anxiety, and cancer. So as you can see from this graph, it indicates that as the BMI increases for an individual, the total expenditure also increases in terms of health costs. So indirect and societal costs can be divided into 3 categories, known as value of lost work, insurance, and wages. So it has been found that obese individuals miss more days of work due to disability, short-term absences, and premature death. This can lead to a productive cost related to absenteeism of between $3.38 and $6.38 billion. Also, employers have a greater life insurance premium for employees who are obese. In addition, some personal or ethical costs that can result from obesity is job discrimination, which results from stigma associated with obesity. Insurance companies tend to charge more premiums for individuals with greater weight. Obesity can also lead to poor quality of life due to physical limitations that arise on a daily basis. In 1960 to 1994, the prevalence of obesity increased from 10.4 to 19.9 in men and 15.1 to 24.9 in women. The main reason for this was attributed to sedentary lifestyle and dietary factors. Overall, the concept of obesity is complex and is a result of many different factors such as genetics, diet, lack of physical activity, medication, and environment. First, the environment and community impacts an individual's decisions throughout the day, including what he or she eats or their level of activity. Individuals from a lower socioeconomic background were less likely to have access to healthier foods, options, and places to exercise. In addition, variations in genes have been found to contribute to having a greater food intake. Moreover, certain drugs, such as steroids or antidepressants, can contribute to an increased weight. According to works of literature, body weight is a result of the amount of energy ingested versus the amount of energy expenditure that occurs through metabolism and physical activity. To a certain body weight, energy intake must equal energy expenditure. Positive energy balance results when there's more energy intake than energy expenditure. Energy balance can also be impacted by genetic and environmental factors. Over time, the environment has changed so that there's a great deal of physical activity is no longer required, and food is easily available and inexpensive. This has resulted in many individuals in America overeating and reducing their physical activity. Therefore, the environment has facilitated an increase in obesity. This graph describes the balance between energy expenditure and energy intake. In the previous environment, individuals had more energy and expenditure and less energy intake. Therefore, physiological control was maximized in order to maintain energy balance. Now, there is more energy intake and less energy expenditure. Therefore, more cognitive control is required in order to maintain energy balance and prevent weight gain. Different strategies have been used to resolve the obesity epidemic. Early education and primary prevention, including programs and checkups, have been used to prevent obesity. Also, healthier food options have become available at schools, hospitals, and places of work. Moreover, newer programs have developed that provide children and adults a safe place to exercise and promote physical activity. Some reasons that these solutions have been ineffective in the past is because healthy food options are more expensive than fast food options, which are inexpensive and give more for the same cost. Furthermore, many adults are unable to have time to exercise due to their busy work or family life. Additionally, many adults may not have the transportation or money required to go to the gym and exercise. Moreover, many individuals are not motivated to do regular checkups and practice primary prevention. The three individuals that I spoke to were Dr. Ajmal, who is a family nurse practitioner, Nurse Vargas, a registered nurse, and Glenda, Director of Patient Care Services. So, Dr. Ajmal is a family nurse practitioner that works in 2 clinics in Long Beach. Nurse Vargas works in a healing care hospice company that treats patients in their homes. And Glenda is a director for the healing care hospice company, and she plays more of an administration role. I chose these 3 individuals because they each provide a different perspective on how they use technology in their unique roles. Dr. Ajmal explained that he used his smartphone to complete a variety of functions such as text messaging, emailing, calling, application use, and internet access. He also was able to use it as a drug reference, manual diagnosis aid, and medical calculator. Nurse Vargas is able to communicate with other people, such as nurses, in her work, and is able to obtain knowledge while she's working at someone's home. Glenda explained that she uses her phone for contact and managing patients. As a result of this interview, I was able to gain insight and advice about the importance of mobile technology in the healthcare field. I was advised to first complete evidence-based research using credible resources. Next, it was suggested that I do a thorough analysis of the app that I want to incorporate in order to resolve the problem. And I was urged to create a script to make sure my video had a clear message that was concise, and I found this advice to be beneficial and used it in order to complete my project. The mobile app that I used to resolve this obesity epidemic was known as the MyPlateApp Calorie Counter app. This app allows individuals to first input their current weight, height, gender, and their level of activity for the week. Then the app's user selects the goal weight that they want to obtain, in a certain amount of time, and then there's a number of calories that the individual can take daily. After the user inputs that, what they eat for breakfast, lunch, and dinner, and then the app calculates how many calories they have left. So you can see here that you can put in your breakfast, lunch, and dinner and amount of exercise, and then it will tell you how many remaining calories you have. Also, the app shows progress, so over a span of a week, and it's calculated for 1 month, 3 months, 6 months, and 1 year. So it shows how the person is progressing over time in terms of losing weight. Also, the app gives recommendations for foods that you can eat on a daily basis, and it also has fitness videos, so in case the person's unable to go to the gym, they can watch these fitness videos and do them at home. And it also has a community blog, which allows users to connect with others, and they're able to gain motivation, advice, in losing weight. This app will help overweight and obese individuals lose weight by making users keep track what they consume throughout the day. This will prevent users from eating above the required calories, and as a result, they will have less likely have a more food intake than they should. In addition, the fitness videos will allow the user to be active at any location without the need to go outside to a gym. Also, the users will gain ideas on what they can do and also motivation and inspiration from other people. And they can create a meal plan based on the recommendations that are offered from the app. Over the past years, innovation has become a part of healthcare and has led to the improvement of patient outcomes and quality of life. Innovation can be defined as a new idea or product that results in a change or improvement. The traditional model for providing healthcare has evolved in order to meet the demands of individuals. Smartphones can be considered to be disruptive innovation because they have revolutionized the way healthcare is delivered and how patients are managed. It was estimated that by 2018, 65% of interactions with healthcare organizations would be through smartphones. The innovative feature in the MyPlate app is that it allows patients who are obese to manage their health on a daily basis and obtain virtual support. The app serves as a guide for patients who are confused about where to start when they want to begin losing their weight. Because the MyPlate app is linked to patient care and treatment, it can improve a patient's health and well-being. Moreover, when a patient goes for a checkup with their primary care provider, he or she can explain in detail their routine for losing weight because she or he have been keeping track of his or her meals through the app and daily fitness. Furthermore, the app also has asked specific questions, so the diet and fitness plan is catered for that patient. As a result, the provider can determine whether the patient should make any changes and acquire an accurate diet history. The app can also be useful for dialysis patients who have a strict diet plan. Research was completed in order to analyze whether smartphones apps are beneficial in helping patients lose weight and lower blood pressure. 189 patients participated in the study with a BMI of 25 or greater, and it was found that the experimental group had significant weight loss. But the MyPlate app allows users to connect with others, and therefore it can serve as a motivation because the user does not feel alone when trying to lose his or her weight. Therefore, I believe that this app will help reduce the amount of individuals who are obese in the United States and is overall a beneficial tool for treatment. These are the references.